Those who watch regularly know this is usually the time we bring in our medical expert, Dr. Kohli. Yep. She's helped us navigate the past several months when it comes to health news. Dr. Kohli joins us live. Hi, Doc. How are you?
Hi, Sam. Hi, Jeff. Happy birthday.
Oh, thank you so much. What a sweetie. What a sweetie.
Yes, she is. And today, what I love is that you want to do something a little bit different. So it was your idea to use this platform on DBL to talk about health issues specific to African Americans and what they can do to keep their community safe and healthy. So let's start by asking, what are some of the health conditions that have worse outcomes for African Americans?
So, Sam, African Americans comprise 13% of the U.S. population, which makes them the second largest minority group. But despite being such a large minority group, there's so many diseases that disproportionately affect them. We've already talked about COVID, how 23% of the COVID-related deaths are in African Americans, even though they only make up 13% of the population. But you can see that it's their life expectancy, their heart disease deaths, their stroke deaths, their cancer deaths, and their risk of diabetes. So it really spans a wide spectrum of diseases. And Jeff was talking earlier about the symbolism of the knee and the neck, and I hate to apply that here, but I think it's so true. There really is a knee in the neck of medical care for African Americans in our community, and we all, as the rest of the community, have to do something to change that.
Doc, what are the reasons for some of these differences, and what are some practices that can keep the Black community healthier?
So, Jeff, some of the reasons are out of our control because they're biological differences, things like genetics, different responses to diseases, and different responses to medications. But a large number of this is due to socioeconomic reasons, like poor access to care, inability to afford the care, poor health literacy, not understanding, what they should be taking. So the rest of us as a community can do a few things. The first is to really educate people, not just within the African American community, but even outside, that these individuals are at higher risk. And that is a key component of this. The second is to actually bring the care to them. So there are a number of studies that have actually taken pharmacists and put them in barbershops or in churches and actually given medication advice and dietary advice and things like that in those cultural institutions within the African American community. And then the final one is really on a political level for us to make care more affordable, more accessible, and that applies not just to African Americans, but really to all of our, underprivileged communities.
Well said, Doctor. Well said. And even to African Americans who are giving birth, they are at a higher risk of mortality because of subconscious racial bias. So these are all things that we need to change. I really thank you for bringing this up, Doctor. You'll be back next week. There's still a pandemic going on, so if you have a question about coronavirus you want answered by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com. Thank you, Dr. Kohli.